Hello and welcome. Today, we're diving deep into a rare and often debilitating condition called erythromelalgia. This complex disorder, sometimes nicknamed Burning Man syndrome, causes intense, burning pain, redness, and warmth primarily in the extremities. Join us as we explore the causes, symptoms, diagnosis, and management of erythromelalgia. The exact cause of erythromelalgia remains a puzzle in many cases. We categorize it into primary and secondary forms. Primary erythromelalgia is often linked to genetic mutations, specifically in the SCN9A gene, which plays a crucial role in sodium channels within nerve cells. These mutations can cause the sodium channels to become overly sensitive, leading to amplified pain signals. Secondary erythromelalgia, on the other hand, is associated with underlying conditions such as myeloproliferative disorders like polycythemia vera, thrombocythemia, or essential thrombocytosis, autoimmune diseases like lupus or rheumatoid arthritis, small fiber neuropathy, diabetes, infections, and even certain medications. At the heart of erythromelalgia lies a disruption in the way our blood vessels regulate blood flow and a misfiring of the nervous system. The vasodilation, or widening, of blood vessels in the affected areas leads to increased blood flow, which causes the characteristic redness and warmth. This vasodilation is often triggered by mild warmth or exertion, but the pain, that's where the nervous system comes in. Current understanding points to dysfunction in the small nerve fibers that control blood vessel tone and transmit pain signals. The overactive or misfiring nerves amplify the sensation of pain, creating the excruciating burning feeling. In secondary erythromelalgia, the underlying conditions further exacerbate these vascular and neural abnormalities. Erythromelalgia is considered a rare disease, and precise prevalence figures are challenging to obtain. Estimates suggest that it affects fewer than 1.3 per 100,000 individuals. Both primary and secondary forms can occur in both adults and children. While primary erythromelalgia often presents in childhood or adolescence, secondary erythromelalgia is more likely to develop in adulthood, reflecting the age of onset of the underlying conditions that trigger it. The hallmark of erythromelalgia is intense burning pain, usually in the feet and hands, but sometimes affecting the ears, nose, or face. This pain is often described as throbbing, stabbing, or searing. Accompanying the pain is visible redness and a sensation of heat in the affected area. Symptoms are often triggered by warmth, exercise, standing for prolonged periods, or even being upright. Many sufferers find relief by elevating their limbs or immersing them in cold water, although extreme temperature changes can paradoxically worsen the pain in some cases. The severity and frequency of attacks can vary considerably from person to person. Diagnosing erythromelalgia can be challenging, as there is no single definitive test. Diagnosis relies primarily on a thorough medical history, a careful physical examination, and the exclusion of other conditions with similar symptoms. Doctors may use provocative testing, such as exposing the affected limb to warmth, to observe the characteristic redness and pain. Nerve conduction studies and skin biopsies can help rule out other causes of neuropathy. If secondary erythromelalgia is suspected, further investigations will be conducted to identify the underlying condition. Erythromelalgia can be broadly classified into primary and secondary forms, as we've mentioned. Primary erythromelalgia is further subdivided into familial, or inherited, and sporadic, or non-inherited, cases. Familial erythromelalgia is often associated with mutations in the SCN9A gene. Secondary erythromelalgia is classified based on the underlying condition that is causing it. Identifying the specific type of erythromelalgia is crucial for guiding treatment strategies. Unfortunately, there is no cure for erythromelalgia. Treatment focuses on managing symptoms and improving quality of life. Conservative measures, such as avoiding triggers like heat and prolonged standing, elevating the affected limbs, and using cooling measures, are often the first line of defense. Medications may include pain relievers like nonsteroidal anti-inflammatory drugs and NSAIDs, or neuropathic pain medications such as gabapentin or pregabalin. In some cases, medications targeting the underlying cause of secondary erythromelalgia can provide relief. Vascular constricting medications can be helpful. Patient support groups and psychological therapies can also play a vital role in helping individuals cope with the chronic pain and emotional distress associated with this condition. Because the precise causes of erythromelalgia are not fully understood, primary prevention is often not possible, especially for the inherited forms. For secondary erythromelalgia, managing the underlying condition, such as controlling blood counts in myeloproliferative disorders or addressing autoimmune diseases, can help prevent or reduce the severity of symptoms. Avoiding triggers such as excessive heat or prolonged standing can help prevent symptom flares. The prognosis for individuals with erythromelalgia varies greatly. Some individuals experience mild symptoms that can be managed with lifestyle modifications and medications, while others suffer from debilitating pain that significantly impacts their daily lives. Recent research has focused on identifying novel genetic mutations associated with primary erythromelalgia and developing more targeted therapies. Studies are also underway to investigate the role of inflammation and immune system dysfunction in the pathogenesis of the disease. Advances in understanding the underlying mechanisms of erythromelalgia hold promise for the development of more effective treatments in the future. Thank you for joining us on this exploration of erythromelalgia. We hope this information has been helpful.